have to find a way to take care of them. So we have to be cautious as a community, as a juvenile justice community, that we don't take away all of the resources, that we don't take away all of our ability to help these kids before we take away the ability to work with some of those. I want to sit in my office. Other guiding issues we have besides statute. There was a 1999, getting kind of old now, but still on the books. Auditor General reviewed juvenile justice services in Michigan and found that the state was not doing enough for preventing delinquency, prevention programs. That's a tough one for us, because we don't actually have those kids in our possession under our jurisdiction at the stage they would need prevention. So what we've done is stepped up our efforts and stepped up with our partners, mental health and the schools and state board to promote funding opportunities for communities to do prevention work. We've been pretty successful with that. The Prison Rape Elimination Act is not just for prisons. There's a juvenile requirement for that too. And we, in the papers a few years ago, both our private partners and the state facilities got a little bit of bad press because of a survey that was done. But we took that very seriously. We have now policies in place and training available, but we are going to be under the, we have to follow the rules of the Prison Rape Elimination Act, and that's very, very serious business. And also, we're very proud of this. In 2005, the Department of Justice entered into a memorandum of understanding with the state of Michigan concerning MAXI training school, conditions of confinement and the constitutional rights of those kids. MAXI and the director, Derek Hitchcock, within 5 years, satisfied all of the conditions of that memorandum of understanding, a clean bill of health with the Department of Justice. Now, the goal is that we have to maintain those standards. So far, so good. Here's just a list of other things, and then I'll wrap up, that the Bureau of Juvenile Justice has responsibility for. We are passed through for federal grants to local communities for juvenile justice. We make the assignment of juvenile justice youth resident treatment referred to us. The policy for field and residential interstate compact for the placement of children, regional detention support services, which is a funding mechanism that we help counties that do not have a detention in order to avoid them with the requirement of putting them in jail, to hold them securely, such things as federal transportation to a juvenile facility. We are now in our second year of pilot for Michigan Youth Reentry. We're turning out to be very successful beginning. We hope to be able to maintain that. Special emphasis programming. We talked a little bit about disproportionate minority contact, gender-specific treatment, and then collaboration with all of our stakeholders. And our goal is to broaden our role in collaboration, broaden our role in partnership with all of you, with all of our other service providers. With that, and become a recognized resource and assistance to those of you who provide direct service. Reading that right, I finished just about on time. I know I rattled through that very quickly, but Esther, just time for questions? Or
we have 5 minutes for questions from the audience.
No, that's not because I was both so clear. But we have a much more informative.
She has a question here.
Okay, so you mentioned a real decentralized approach, and I see we also have that with how we provide indigent counsel or counsel for indigent offenders. And there's been a move through Campaign for Justice to try to get a single-state system for that. Is there any movement, any discussions about trying to get a uniform state approach to the justice system rather than a variation?
Well, I would say that that's going to take a lot of discussion. Yes, there's been a lot of discussion just amongst practitioners. It's something that we should strive for. It's something that the state's role, I think, could be to help collaborate and help facilitate a discussion. But then, as I said, there will take change in statute to make that formally happen or to be required. But the discussion is a good one to have.
Yeah.
2 questions. One, is there much interagency, interdepartmental cooperation around this? I'm thinking particularly of the education department? And as just a second question, have you broken down these figures by ethnically identifiable needs?
First question, is there collaboration amongst the different departments and the different agencies? I'd say that also is decentralized. Some counties do that much better than other counties do that. At the state level, we have good partnerships with our other state departments. However, we all have our own struggles and our own priorities, so it's not as good as it could be, in my humble opinion. But I think that there's individuals in all departments that really want that to happen. The second part of the question, I think I referred to our expert Paul, and I guess I'd ask if you might talk, as far as the statistics for the different ethnic breakdowns, I think they exist, but I don't have them.
My question was, how has the role of BJJ and or staffing changed? Because you decided to staff in 2000 and 2011. You had almost as many staff as you in 2011. And currently you have more staff than you have you under direct care. So I'm just curious, like, what BJJ's role now, how that changed?
Yeah, BJJ's role now is it's economy of scale, first of all. When you have a large 500-bed facility, there's certain services like clinical and of course business office that can serve a lot more kids when we have less kids. Like for example, a group leader. You need a group leader when you have 5 kids in the group or 10 you're in the group. So the reduction of kids doesn't always translate into an equivalent reduction in staff. Another part of that is that there are some ancillary services that we have that are listed in the that did not change. Our facilities have shrunk, but our responsibilities centrally to the state have not changed.
We have a chance again to ask questions, so maybe we can